Hi, everybody. Welcome to our Cancer Fit education for this week. Today, we will be talking about balance and fall prevention. So if you have your cancer education booklet, remember you received it at your orientation or you came in the fitness center to pick it up. We're going to go to the fall prevention. So it's a little bit towards the back. So if you want to find that, if you want to pause the video to find the fall prevention, and that's what we're going to be talking about today. The next video will be focused on balance exercises. So we're going to first talk about fall prevention, how to prevent a fall, and why balance is so important. And then we'll go ahead and into our balance exercises. So if you've paused it and found your page, I'm going to go ahead and share the screen here. So you'll see the handout you have. All right, so you should see it on the screen. Let me scroll to the top. So it should say fall prevention. All right, so we'll just quickly, it's not going to be an all-encompassing fall prevention or, every detail about balance. We're just going to hit, to me, some of the most important things about fall prevention. So let's get started. So having good balance and stability is very important for preventing falls. So the better balance you have, the less you're going to fall because you're going to be more stable on your feet. Your legs are going to be stronger. Of course, as we age, unfortunately, falls are more common because you lose a lot of things that help with your balance and with your stability. And we'll get into that in a little bit. But a lot of those things that are age related are preventable. So you want to really make sure that you're not a fall risk or you're not having multiple falls, because once you fall, you can suffer a severe injury that would set you back or change your independence level. And a lot of times we hear stories where people are doing fine, they're doing great, and then they have a fall and then it's a snowball effect. It's all downhill from there. They never kind of regain that independence they want to have. So what we want to do is try to prevent the falls as much as possible. So what can you do to decrease your chances of a fall? So let's just first talk about why people fall. What are some of the common causes of a fall? First, poor vision and hearing. Makes sense, right? So if you can't see, you can't be steady on your feet, or you won't see an obstacle or something in your path, or you can't see very well to walk or know where you're going. So you want to make sure that that your vision is the best that it can be. Hearing as well. A lot of times the hearing is lumped in with the vision, and that goes into that proprioception. And then if you think about vertigo, that has a lot to do with inner ear issues as well. Vertigo is that kind of illness where you have that dizziness all that time, that swimmy feeling in your head, and that can be linked to inner ear issues. So if you can't see or hear well, that can affect your ability to move around your home, around the community, going out in public to different places. So you want to make sure that you're staying well ahead on your vision exams and your hearing exams. There are also age-related eye diseases such as cataracts and glaucoma that can affect your vision that you can go to the eye doctor and do something about. So again, have those regular eye exams, have those regular hearing exams, wear your prescribed glasses, wear your hearing aids. So a lot of times people don't like to wear their hearing aids because I think sometimes they're too loud or they're just cumbersome, especially now with wearing a mask. But you want to make sure that you're wearing those, you're wearing your glasses regularly. If you do have sudden changes in your vision or your hearing, that you immediately call your doctor to follow up. So you don't want to prolong those things. One time I had a floater in my eye, and I still do, and it was very important for me to go to the eye doctor and just see if there was anything that they could do about it, because that was affecting my vision, which is dangerous, not only for walking, but it could be for driving as well. Also, a lot of times, sometimes we can't see because it's dark. So think about when you wake up in the middle of the night and you have to go to the bathroom and you don't turn lights on and you fall over something because you didn't want to turn a light on. So make sure that you have good lighting in your home. You use night lights in your home, especially at night when you're moving around. I know you're probably saying, well, I've lived in my house for 50 years. I know this house like the back of my hand. That's great, but that's not necessarily true. There are a lot of people who've been living in their house for a long time and still get up in the middle of the night to go to the bathroom, don't turn on the light and fall. And remember, we don't want that snowball effect. So proper vision and hearing, make sure that you're following up on those things. Second thing that we have here, a common cause of a fall, is taking unnecessary risk. And this one, I would say, affects everybody. So a lot of times we think that only older people tend to fall, but taking unnecessary risk is a reason why so many people fall all the time, not just older. So we sometimes we put ourselves in unsafe situations and we increase our risk. So sometimes just our daily activities, we don't think about it, we're trying to rush through it, and that puts it at a risk. An example of an unnecessary risk: say you need to reach something on a high shelf, and instead of getting a sturdy step stool, you get a chair with wheels because it's quick, it's easy, it's right there. You stand on the chair, you fall. You know what the rest. So that was an unnecessary risk. That did not need to happen, but you were in a hurry. You didn't think things through. You thought it was going to be all right. So sometimes we just take risks that we know we shouldn't be doing, but we do them anyway. Hazards around your home can also be unnecessary risk because you can easily sometimes fix those hazards around your home. Think about cords. If you had all these electronics plugged in and you had cords everywhere and they were just right in the middle of the floor and you trip over them, that's an unnecessary risk because that could easily, moving the cord out of the way, making sure that maybe you put a rug or a mat over the rug, over the cord. So those are things that you can do. So if we go down to the what can I do? So using a step stool, something sturdy to reach high places, fixing unsafe areas in your home like a walkway or stairs. You want to make sure that you wear shoes around the home or some slip resistant socks because if you don't, then you can easily fall. Slow down, don't rush. I need to tell myself that. So take your time in doing things. The more you rush, the more you're at a risk for a fall. If you have a very heavy object, ask for help. Hold on to the handrail, especially if you don't feel steady. Make sure you're holding on to the handrails when going up and down stairs. Minimize sudden movement. So if you have a movement from a standing to a seated position, or I guess a seated to a standing position, take your time. And especially for cancer survivors, this last one here is do not overwork when tired. So a lot of times when you go through cancer treatment or just having cancer itself, you have that cancer related fatigue that we talked about in one of our other topics. When you are very tired and fatigued, you are at increased risk for fall because maybe you're not picking your feet up, maybe you're just so tired, you're not paying attention. So when you're feeling like that, remember rest. We talk about that roller coaster with fatigue, rest, because then if you don't, then you can put yourself up for a fall. Next, certain medications can cause dizziness, drowsiness, loss of balance. And that, of course, will put you at an increased risk for a fall. So sometimes you're like, well, it's medicine, it's prescribed. What can I do? But there are things you can do. If we go down to the next, of course, only take your medicine as prescribed. If you want to do any changes in your medicine, make sure you talk to your healthcare provider first. Use only your medications. Don't use anyone else's pain pills or anything like that, even if you're having pain and that'll be easier or quicker. Visit your doctor if you are having lightheaded, dizziness, or drowsiness. Make sure that you visit your doctor and they can review your medicines and let them know your symptoms. Um, and then just know the common side effects of your medicines. If you know a certain medicine makes you drowsy or dizzy, maybe take it at night when you know you're going to go to sleep. Don't take it in the morning when you still have to move around. So just having that open dialogue with your healthcare provider and knowing the medicines you're on will help. Next, we'll go to chronic illness. So, of course, cancer is considered to be a chronic illness because it lasts for a long period of time and there's no known medical cure. So that's just an illness. A chronic illness is something that lasts for a long time. There are other chronic illnesses as well. Arthritis would be one. As a chronic, it's something that you just can't take medicine and then the illness is gone. So that increases your risk for fall. Of course, the side effects from treatment and cancer itself. So we just talked about feeling tired, ill, fatigue. Also, when you're tired and fatigued, you may not do much movement, right? You may spend days in bed. When that happens, you are weaker. Your muscles are weaker. When your muscles are weak, you can't stand, you can't move as well, you're at increased risk for fall. So what can you do about that? Well, try to remain as active as possible. That's why you're looking at this video. That's why you're in the Cancer Fit program. You're trying to do exercise to help you remain active and increase your strength or maintain your strength. Make sure that you do talk to your doctor before you start any exercise program just to make sure it's appropriate. Find exercises that do not cause discomfort or pain. A couple weeks ago, we talked about the old adage, no pain, no gain. And I said, that's not true. It's not true. So if something's causing you a lot of discomfort and pain when you do it, one, it's probably not good. And two, you're not going to do it if it causes pain and discomfort. So try to find something that you like to do and doesn't cause pain. And then you want to make sure that you have a good strength and balance program. The strength training that we do in here is very good for balance. And we're going to do some things today with the next video coming up that's going to work on balance. So you want your program, you want hand and eye coordination, power exercises, speed, direction change, everything that you're going to encounter in your everyday life. You want that in your exercise program when working on balance. And then, of course, unless a doctor has told you otherwise, you want to make sure you're drinking plenty of fluids and have a healthy diet. Next, fear of falling. So this is a one that's very interesting. So sometimes people are very scared of falling once they've experienced a fall. Maybe it was very traumatic, they fell once and now they're terrified. They do not want to fall again. So when they have that fear, they withdraw. So they don't go to social activities, they don't do more things, they don't go outside their house as much because they feel like, okay, you know, I fell, now I just need to stay in the house and not do anything. Well, that's not good because, of course, once you withdraw and you're not doing anything, what do? You get weaker. And so that increases your risk for fall. So it's just a downward spiral. So you shouldn't let that fear lead to inactivity because that's going to increase your risk. So what can you do? Once you have a fall, and even if you're scared to get back out there, make sure that you are doing exercises to help balance and strength. Try to find hobbies that you like to do that can help kind of reduce that fear because you're enjoying doing those activities such as gardening. Try to return to your everyday activities as soon as possible. The faster you can get back out there, get back into doing things, that's the better that fear won't set in. And don't be ashamed to use an assisted device. So many people, once they fall or they have an injury, they just don't want to use a cane or a walker because they feel old. They feel like people are looking at them. And that's not the case. You know, that cane or that walker is assisting you. It's helping you prevent the fall. So don't be ashamed to use that. So the next thing is, what do you do if you fall? So let's say you do all these things and you still end up having an accident and you fall. Well, make a plan. So have a plan to know that once I fall, this is what I'm going to do. So you can wear those life alerts, so personal alarms around your neck. That way you can press it. I think they can sense if you fall, and they'll have an operator come on. So those are really handy. Try to keep a mobile phone or cell phone with you at all times. If you always have that cell phone on you, then when you fall, then you can immediately call for help. You can carry a whistle. So if you live in a community or somewhere in a house, you can just have that whistle. That way, if you blow it, somebody will hear it. Of course, if you live by yourself, that may be a little difficult. A very important one that I think is good, if you have a neighbor, a friend, somebody you feel comfortable with, try to leave a spare key with them. Because a lot of times some people fall in their home and there's nobody they may not check on them. And then they end up staying down there for a long time. But if you have a good sense of community and you have someone that's a friend and you can say, okay, here's a key, if you ever don't hear from me, then make sure, you come check on me. Also, letting people know your habits, your whereabouts, having that close connection. People may know when something is wrong. Let's say you have a really good neighbor and they knew you took your trash cans out every Tuesday at 4. And if maybe they notice your trash cans are not out Tuesday at 4, and I say, you know what, something may be wrong, and they may be able to come check on you. So that goes both ways. If you have a good neighbor, know their habits as well. So just having that sense of community is great for having a plan for if something happens like that. Last, getting up after you fall. So we're going to go over this in the next video, how to get up after you fall. But if we quickly kind of go over it, you want to make sure that you stay quiet, don't panic, because panicking and getting nervous will not help the situation. If you're injured, you want to make sure that you stay where you're at because, if you are injured and you try to get up, you may make it worse. If you're not injured, try to use your best judgment. If you feel like you can get up without calling for help, just try to get up. And the next video, we're going to go over how to get up after you have fallen. So that's pretty much it. That's fall prevention, very short, quick. If you have any questions, remember I will be calling you and emailing you. You should have my email address. So if you have any questions, just let me know. All right, stay tuned for the next video.